Namaste, Chairman.
Namaste, sir. Welcome. Namaste and good afternoon, ladies and gentlemen. On behalf of the Apollo Hospitals Group, I welcome members, colleagues and friends of this conference. As I begin, may I just request everyone to, as you join in, to kindly mics on
Dr. Karan, your audio is not...
Yeah, is it better now? I think because of a few mics being on, I think there's some distortion. Is it better, Ahmed?
Yes, it's better now.
Thank you. So let me begin first and foremost by a very special welcome to our chairman, Dr. Reddy. Sir, thank you for being here today on the eve of World Health Day. Welcome also to Dr. Samitha Reddy, Joint Managing Director of the Apollo Hospitals Group. Ma'am, welcome and thank you for being here today. I welcome also to the other panelists, Dr. Anupam Sibal, Dr. Subrat Kaur, Dr. Satya Sriram. Thank you for your presence. Thank you. Ladies and gentlemen, as I mentioned, we are gathered here today on the eve of World Health Day. It is therefore germane to pause and understand the state of health of our nation. Other than the impact of COVID-19 that the nation has played for the past 2 years, diseases and conditions, most notably non-communicable diseases, did not relent. Their presence may have escaped our collective cognizance, but they are present and continue to pose multiple challenges to our population and the health system. Today we have gathered to better understand the health of the nation through the release of our special report on the prevalence and distribution of NCDs across the country. As I begin to call our first speaker, may I once again just request everybody to kindly keep your mics on mute. We will have a Q&A session post all the speakers' address to us. And if there are any questions along the way, please do feel free to put them on the chat box on this console. With that, may I now invite Dr. Samitha Reddy to address this meet and set the context for this report. Ma'am?
Well, namaste and good afternoon. It's truly a pleasure to be amongst all of you today. I believe that it is critical for us to really understand the context of what we're doing today, and that is that we bring out with the complete sincerity and the intent to help build a healthier world and a healthier community, the concept of the Health of the Nation report. All of us are very clear that primary health care is getting more and more importance. We are seeing the correlation between primary, secondary and high and tertiary care. All of you know Apollo in its avatar as a high-end tertiary and quaternary care healthcare provider, whether it's advanced heart surgery, neurosciences, emergency. But with equal momentum and equal passion, guided by our chairman, we have focused over the last 40 years on prevention. And what we're bringing today is together for the second time the concept of the Health of the Nation report, which is a collation of our data to bring forth some very important points. The first one, I think, is in addition to the well-known burden of communicable disease, our nation is now in the grip of this silent but significant, what our chairman calls tsunami of non-communicable disease. We know that comorbidities exacerbated anyone who had COVID, and therefore it is shown yet once again that we need to keep our population healthy. We know as individuals and as a nation, we cannot afford to be a silent witness to this silent epidemic of non-communicable disease, and we must all come together to do the very best that we can. As individuals, we must embrace prevention, we must understand our risks, we must mitigate these risks with exercise, weight management, diet, appropriate medication. And as healthcare providers, we feel this responsibility to create a system, a structure, and a proactive approach towards detecting disease early, managing to help keep the population healthy. I want to also add that everything that we're hearing in terms of the digital agenda, whether it's AI or big data or ML, the use of devices, the Internet of Medical Things, all these have a very important role to play in large-scale screening and hastening prevention. So this initiative is also looking towards reaching out to more and more people, detecting early, and we call upon startups, other associations, institutions to come together to share data and to find new solutions. And today we're sharing many of the solutions that we are working on. I would also like to add a very important aspect is recognition of the risks, and early detection of illness is key to keeping people healthy. And knowing the power of data and the future of AI is something which will bring all this together in a very, very powerful manner. So it's population health, it's digital health, it's a proactive, preventive approach. And finally, it's an acknowledgement of the fact that healthcare is the responsibility of individuals, of doctors, of governments, of corporations, but most importantly of all of us together, including the media. And therefore we present to you the Health of the Nation report to give insights into where is the health status of the country moving, what new trends are we seeing, and what intervention should be done. Thank you all very much and welcome. Namaste.
Thank you so much, ma'am. So as we segue from what context that we've been given about this report to what the findings of this report actually are, may I request Dr. Anupam Sidhu, Group Medical Director of Apollo Hospitals, to share his insights.
Dr. Reddy, Dr. Samitha Reddy, colleagues on the panel, distinguished members of the press, good afternoon. Thank you very much for finding time for us. If I might have the first slide, please. So how healthy are we today? Satya, the next slide, please. So let's look at diabetes. Now, I know that all of us understand that we have a problem. But how big is this problem? So if you look at prevalence of diabetes across India, it's a staggering 6.7%. Now, this is data I might add from 380,000 case studies. So those were the subjects that were studied pan-India. So if you look at prevalence of more than 8.2%, you see that in Meghalaya, in Tripura, in Mizoram, in Jharkhand, Odisha, Andhra Pradesh, Telangana, Goa, in Diu, the prevalence is more than 8.2%. And then we have 4 states, Bengal, West Bengal, Karnataka, Kerala and Tamil Nadu, where we have between 6.9% to 8.2%. We also have Delhi and Chandigarh in that category, and then of course we have 4 to 6.9%, which is the rest of the country, other than Arunachal, where it's less than 4%. Now, is there a difference between urban and semi-urban? And I think we've clearly been able to see here that there isn't a significant difference, 7% versus 6.7%. What happens with age? In young individuals, less than 35, 2%. Now, see the dramatic jump we get from 36 to 50. It goes from 2% to 11.6%. And then 51 to 65 years goes from 11 to 24. And then older than 65, it gets to 30%. 36 to 50-year-old men have a 1.4 times higher risk of diabetes than women. So that's a point that we all need to recognize. Next, please. Let's look at hypertension, a slightly different scenario. But again, not a dramatic difference, though more than in diabetes, between urban and semi-urban, 8.6% to 7.58%. But look at prevalence, and it's really telling in the northeast. Arunachal, Assam, Tripura, Mizoram, Nagaland, prevalence of more than 11%, Goa, and then 8.18 to 11% in Jammu and Kashmir, large number of states in the Hindi heartland, and then Telangana, Andhra Pradesh, Odisha, and Gujarat. And 6 to 8% is the rest of the country. Again, in individuals less than 35, 3.3%, very dramatic increase to 13.5% in 36 to 50, and then tripling up to 32% in 51 to 65, and older than 65 to 40. So clearly, after the age of 35, and Dr. Reddy will perhaps allude to this, we used to think about after 40. And Dr. Reddy perhaps is going to talk about less than 30 what we are seeing. So I think with changing lifestyle, the kind of stressful environment we find ourselves in, the lack of exercise, erratic lifestyles, not focusing on proper diet, a rhythm or routine, a discipline that the body needs, we see a dramatic increase after the age of 35. And again, a 36% higher chance of hypertension in older individuals. Next, please. Let's look at chronic obstructive lung disease and asthma. 2.2% across the country. Urban, semi-urban, no great difference. If we look at more than 2.5%, Rajasthan, Delhi, Odisha, Bengal, Jharkhand, Tripura, and Mizoram. Between 2 to 2.5%, we have the Hindi heartland, we have Kerala, and then between 1.7 and 2.17% the rest of the country. Here we notice that between 18 to 35 is 1.89, 36 to 50 1.92, so no real difference. Older than 50, so 51 to 65 is 3.3, and then older than 65 we get the jump going up to 10.5. 8%, and women in the age group of 36 to 50 have a higher chance of COPD than men. Next, please. If we look at what cholesterol does if you are going to develop diabetes. Now, clearly, with high, with dyslipidemia, which means high cholesterol, or some of the other lipid parameters or profile being abnormal, both in men and women, the glycosylated hemoglobin is deranged. But what is clear here is that if you look at the left chart, you see that in women there is a greater increase in glycosylated hemoglobin. So that's something to remember. Next, please. What about what happens with weight gain and diabetes? So if we look at normal overweight obese, we look at men and women, as they put on weight, the glycosylated hemoglobin has a tendency to get deranged. But what is pretty telling is that in women between the age of 35 to 50, there is a faster progression towards diabetes with increase in BMI. So, is the sample size. So diabetes is more or less the same at 18%. Hypertension goes up from 9%, is what we found in our earlier cohort, to 28%. Dyslipidemia, 32 to 48%. Obesity, 11 to 18%. Now what is different about this time period is that we were grappling with COVID. So the normal routine was off, people were working from home, and because there was a lack of discipline in terms of the rigor of going to work, exercise, eating at proper times, we see what happens. We get dyslipidemia, we get obesity, and we know that they go hand in hand with hypertension. Now what about different sectors? If you look at employees with at least one non-communicable disease, banking, 65%, manufacturing and automotive industry, 59%, industrial work, energy sector, 57%, and this is in fact quite telling. Healthcare, 49%. So the caregivers do not care for their own life. They do not find the time to look after themselves, and this I think is rather worrying. IT sector also 36%, much lower than the rest, but don't forget they're all young people, they're all in the mid-20s, so we would want it to be much lower, but 36% of them have at least one non-communicable disease. So overall, corporate India needs to start looking towards improving the attention that they currently give to improving their health of the workforce. Next, please. Now let's look at cancer. By 2025, 1 in 1,400 women above the age of 40 would have breast cancer. It's a very large number. 1 in 850 over the age of 40, oral cancer. There is a concern that the actual numbers are at least 1.5 to 2x of what we see, because there is a delay in diagnosis, there is obviously a lack of awareness and screening. And this is very worrying because we know that if there is a delay in diagnosis, the outcomes decrease considerably. Breast cancer, 2.7 times. Cervical cancer, 17.2 times. So the longer the time between the appearance of symptoms, diagnosis, and then treatment, the worse the outcome. Next, please. Now, if we look at what we learned with mammograms, and this is a sample size of 23,000, we found that 10% of women had findings that warrant further investigation. That would mean perhaps the need for a detailed ultrasound, an MRI, and of course, a consult with a specialist. And what we found in individuals who we had treated with breast cancer at the Apollo Cancer Center in Chennai, that less than 1% of the deaths were due to complications from advanced disease in the last 2 years. And again, the point we're trying to make here is the sooner the attention is towards diagnosing the condition, the sooner a diagnosis is confirmed and sooner a multidisciplinary approach to treatment is initiated, the better it is, and it has a definite impact on